देख वापस जाना तो डबल क्लिक और ये क्रॉस नहीं करना go to OBS switch off the mic.
It started? Okay. Oops. Hello, everyone. Good morning. It's a happy Sunday. Good morning, everybody. It's a happy Sunday today. Good morning. Good morning, everyone. So, on Sunday, you all are here for PAATHSHALA class. This is the first PAATHSHALA class, that is pharmacology. We will be doing a lot of questions and a retrograde study. So, what is PAATHSHALA, everybody? PAATHSHALA is just like, we used to see in films or we used to do in kindergarten, like how we used to learn our rhymes. We used to repeat after the teacher, learn them, relearn them, and those rhymes like Twinkle, Twinkle, Little Star, Mary Had a Little Lamb, all are still engraved fresh in our mind. And that is the funda behind PAATHSHALA. That means we are going to learn life. Learn, yes. Good morning, everyone. Good afternoon. We are going to learn life, right? It is offline like online class. Okay, everybody. For whom it is for everybody who wants to do a retrograde kind of a study. For all those who have at least done a syllabus once, they have gone through it once. And how is it different? It is different because it will tell you how to solve the question. In the recent 2026 NEET MDS exam, what did we see? We saw that the questions were lengthy. We had to have a good grip on any subject, be it medical or be it dental. Now, first myth I really want to break, everyone: medical is important. Many people on social media will come and tell you medical is not important. Just do dental, just do pulse, just do this, just do that, and you will crack. No, I'm going to burst that bubble for all of you because medical determines whether you clear the 500 mark, and medical determines whether you get into first 100. So medical subjects are very important. But the correct thing should be they are not as important as the dental. They are very important. You need to have a grip. You need to know certain aspects of the medical subjects very thoroughly. But dental, you need to know everything. That is the difference, right? For the medical stuff, I am there. I'm Dr. Jasmine. I hope you know me. And I'm going to really move you through the medical aspect of NEET MDS. So let's begin. Okay. Now, everyone, this is the journal pharmacology. I hope all of you know what is journal pharmacology. Journal pharmacology, very important topic. At least 2 or 3 questions come every year from this particular topic. And 2 and 3 questions is a big deal. It's a big deal. It's a make or break deal. Now, this year, 2026, just on 1 or 2 questions, there were like 50 ranks. Correct? So let's begin, everyone. The first question. See, you can tell me the question, answer, and I will tell you how you have to study retrograde study. Right? Okay, let's start. And when we are tired, we are going to have a story time too. But right now, we are full on Sunday energy. So let's begin with the question straight away. Okay? Chalo, let us start. Bioavailability. is what? This is the question. Suppose you don't know the formula. I hope it's okay. Let me just increase the size. I hope it's visible now, everyone. Yes? Give me a thumbs up, everybody. No, beta, Jevriam. Not all classes will be on the YouTube. This is the first class. So, first class is obviously on YouTube, right? Okay, give me a thumbs up, everyone. See, there are two things which are mandatory in my class, which are mandatory. I do not care about whether you know a topic or not, because for that, I am there. But two things which are mandatory is you are all going to have high energy, right? And second, you are all going to be smiling and laughing. That is the prerequisite. So for that smiling and laughing energy, let us, just fill a injection full of laughter, full of happiness, and let us just put it inside our arms and, just laugh, just smile. Don't worry about the question. See, everyone, I do not care whether you know a concept or not. For telling you the concept, for making you learn the concept, I am there. Right? Once I teach you the concept and you understand it well, then comes your responsibility. Right? Then you will not forget it. See, I will teach you, you will not forget a concept. But once I teach it, once you understand it, it is your responsibility to keep on revising it. Let's begin. Okay, so bioavailability. I am not going to straight away look at the question and the options. First, I'm going to glide through what is okay, what is bioavailability, right? So what is bioavailability, everyone? Simple terms, it is the fraction of a given dose that reaches the systemic circulation. Simple. Suppose I am giving 100 units of a drug. No ml, no nothing, gram, nothing. Just very easily understand, I am giving 100 molecules or 100 units of a drug. How much will it reach in the blood? Right? Suppose it only reaches 20 or 80. What happens in between is the first pass metabolism. But how much of that drug is reaching the blood? How much of the drug is going to act is bioavailability. Correct, everyone? See, everyone, my fuel is going to be a thumbs up and your smiles and everything. Right? So if I ask you for a thumbs up, you give me a thumbs up, because this is not just an online class, it's an offline class. You are there in front of me. The only thing difference is I cannot see you. You all can see me. Okay? Chalo. Now, suppose I give 100. Only 20 reach the blood. Getting my point? So I need to increase the dose of the drug. I gave 100 and only 20 are reaching the blood in the systemic circulation. That means only 20 is going to act. So this is very important analogy, that more the bioavailability. I give 100, 90 reach the surface, 90 reach the blood. That means this is A drug, this is B drug. I need to give less dose of B. Right? And I need to give more dose of A. So bioavailability determines the dose of the drug. More the bioavailability, less the dose, less the bioavailability, more the dose. Correct, everyone? Now, factors affecting. Number one will be absorption. Suppose I gave 100 units, everybody, to a drug, of a drug to a person. Right? But the person's body can only absorb 50% of it. 50 is going waste. Right? So more the absorption, more is the bioavailability. Absorption will depend upon many factors. Right? Less the absorption, less is the bioavailability. So two direct questions from bioavailability which can come. Second, the factor which determine bioavailability is route of administration. I take a tablet. Okay. You take a tablet, everyone. All of you have had a tablet. All of you have had an injection. Even for a painkiller, I am sure life mein kabhi to once in a while you would have had an injection. Right? Or you would have seen someone get an injection for pain. So I take a combi flam or I take an injection of painkiller. Which is going to act faster? Which is going to act faster, everybody? Tell me. I take a combi flam or a diclofenac or I take Neoslid or I take any painkiller and I take an injection of that. Which is going to act faster? Yes, please tell me, very quickly tell me, because you have to learn with me. This is not a theory class. This is a learning class. Which will act more? Yes, definitely the injection. Correct. So what happened during the injection? During the injection, I gave the drug directly into the blood vessel. Right. So when I give directly IV, like somebody is dehydrating, I give normal saline by IV route. It is going to have an instant effect. Right. So IV route has 100% bioavailability. Oral route has least bioavailability. What is the reason, my dear students? Whenever I take oral drug, it first has to go through the mouth to the tummy to the intestine, and there it has to undergo even to the liver to go under the first pass metabolism. What is first pass metabolism? First pass means the drug has to first pass through something and there it is broken down, metabolized, whatever is done. Right? First pass metabolism occurs in the liver. So oral route will have a lot of first pass metabolism. That is why it has less bioavailability. IV route may I bypass the liver absolutely. I do not have the tummy, intestine and all that route and then the liver route. No, the liver is said bye-bye and directly the drug is in the blood. When the drug is directly in the blood, it directly reaches where it is paining. So bioavailability is 100%. Okay? Very important questions, very important. See, the aim of the teaching is to make you well versed with the questions. Okay? Next, first pass metabolism is also pre-systemic metabolism. That means before the drug enters the blood, what happens to it? And it happens in the liver. More the first pass metabolism, less is the bioavailability, as I have seen in the oral route. Less is the first pass metabolism, less is the bioavailability, as I have seen zero first pass metabolism in IV route. So I have 100% bioavailability. Right? Give me a thumbs up if this is very clear. This is a lot of questions, everyone. Right? How can the questions be framed? Number one, there is a drug A. There is a drug A. The bioavailability of that drug is very low. What should a doctor do so that it gets its effect? So the doctor should increase the dose. Right? Then if a drug is absorbed 50%, second drug is absorbed say 80%. Which is going to have more bioavailability? 80% absorption. Then a sure short question. IV, what is the bioavailability? 100%. Then first pass metabolism. A drug A has high first pass metabolism. Drug B has low first pass metabolism. Which one is going to have high bioavailability? And bioavailability definition. So these are all the PYQs, and PYQs form the basis of your theory. Right, everyone? And that is why if you have read bioavailability or journal pharmacology once, I just want, before you enter Pathshala, I just want all of you to know what is just a term. Okay, bioavailability. Rest is my job to teach you. Okay. How do I calculate? I calculate it with area under the curve. I take the drug concentration or plasma concentration and time graph, right? Again, important, what are the two X and Y things? And I plot two graphs, right? One is the bioavailability of oral when I give it orally. Another is the bioavailability when I give it intravenously. Fine. And I calculate the area under the curve, right? And I use this formula. Bioavailability is area under curve oral by area under curve intravenous. But here is a catch. Here is a catch, everybody. This is a percentage. Remember, the oral was having only 5% bioavailability. Then IV was having 100%. So percentage for anything to convert a fraction into percentage, I need to put 100 in the formula. And that is what is the question. Correct? And here in bioavailability, remember nitroglycerine drug. Nitroglycerine drug, if I give it orally, it is going, why it is given? It is given for angina, right? It is the drug of choice for angina. Now, if I give it orally, then it is going to take a lot of time. The patient is going to be in so much of distress, right? Inguinal pain is almost like a myocardial infarction pain. So the patient is going to be terrified and everything, and he is going to be in pain, he's going to suffer and everything, right? So I use nitroglycerine. And what route do I use? I use sublingual. I keep it below the tongue. Very important PYQ, everyone. Previous year question, very important PYQ. Nitroglycerin is given sublingual nitroglycerin, not oral, not IV, not IM. Sublingual. Why? Because number one, it has a very high first pass metabolism. If I give through oral, it is going to be destroyed by the liver. There is going to be no action. Correct? So what do? I need a route which has no first pass metabolism or less. Below your tongue. Everyone, you all are dentists, you know how thin the skin and the mucus is at the base of the tongue. Right? The blood vessels, right? You all have seen it in the floor of the mouth. So I keep my drug there. It goes directly into the blood. No first pass metabolism or less. Right? Now, it is very fast acting. So somebody is having angina in the flight, maybe. He can pop a pill in, just put it in below the tongue. He'll be fine. Right? So in emergency situations, I can use it. Third benefit, everyone, is suppose the effect has come. The remaining drug, the patient is asked to spit out so that side effects cannot occur. Okay. And fourth, it can be self-administered. And herein, I would really like all of you to know, even if you are very young, you can tell it to your parents also, you can tell to relatives, you can tell to friends. And plus, it is one info which is also for you. Right? Because heart attacks are happening now in varied age groups, not just in older people, in younger people too. So, like you are traveling somewhere alone where you think you'll be very tired, and maybe you have had any symptoms before, right? Always, irrespective of the fact, what is your age? I am young, nothing will happen to me, I work out, right? So, heart attacks are happening in the gym. Right. So heart attack post COVID are happening anywhere, everywhere to anyone. So always keep aspirin or dispirin with you. Number two, clopidogrel drug. And third, nitroglycerin. These three drugs always have to be kept in your pocket. Especially if you're going by a flight, especially if your parents are going by flight, tell them it doesn't take much of time and space, but keep it, because they will delay the effect of myocardial infarction. Right, everyone? So Disprin, anybody, there was once a case, a student called me, okay, ma'am, yesterday in front of me, a person died. A young man died. He was having heart attack, and I couldn't do anything because I'm a dental surgeon. I didn't know what to do. And that was the day I felt, okay, why don't we know all of this? Why can't we know all of this? We have to. So now through me, you know this, and you have to follow it. And this is even a question also. This is also a PYQ. So whatever I say in class is never going to be baseless. So what is the PYQ? The PYQ is in acute myocardial infarction, which drug can prolong or which drug can prolong longevity or which can decrease mortality. So aspirin drug. Second beta, which NSAID? Aspirin. Third question beta, what is the double plate antiplatelet therapy? The double antiplatelet therapy is aspirin and clopidogrel given together. So now what do we follow? We don't give only one drug to the patient. We follow the double antiplatelet therapy. Clear, everybody? So another MCQ from another chapter, but done right here, right now. Okay, done. So this was bioavailability. So this you must know. For example, beta, if suppose some numerical comes in the exam, right? They will give you area under the curve. They will give you. You don't have to find out. So do not worry about how will we calculate area under the curve, ma'am. Clopidogrel. Timworks, clopidogrel. Clopidogrel, which is a strong antiplatelet drug. Correct? Done, everybody? So you will be given area under the curve per oral. PO is per oral. Area under the curve IV will be given to you in 200. In 200 is important because bioavailability is a percentage. Done, everybody? Let us see the question now. Okay. Bioavailability is area of oral by area of IV. Yes, this looks right. Most of the students would do this right. This is not true. This. So always, in the paper, while you are giving the answer, A and C will look similar. A hai, C hai, A hai, C hai, you will get confused. At that point of time, your correct knowledge, your concept, and your revision will come into play. Right? Though your CKR is very important. Concept, knowledge, and revision. Right? Sure. Let us do next question, everybody. A highly ionized drug. See, few questions. I will do the concept building. Rest of the questions you can keep on doing yourself. Right? Okay. A highly ionized drug. Okay. Read the question, everybody. Read the question. There is one key concept over here. CKR, everybody. CK and R is my responsibility. All these three words are my responsibility. I will build up your concepts. I'll give you knowledge what is coming in the exam, not what is pharmacology, not what is medicine, but what is coming in your NEET PG entrance. Okay, revision. For revision, I always say 3 times. If you are studying with us, 3 times revision I will do. 4 times revision you have to do. And then, bete, I don't think there is anybody in India who can compete with you. Okay, so let us see the concept over here. Okay. Highly, see bete, सबसे पहले suppose this is the drug A. Okay, this is the drug. Now, this drug can be ionized, matlab it can be in ionized form, A minus, or it can be unionized. That means it may combine with a plus ion chemistry, basic chemistry, Ha. Now, the issue is which you have to learn, unionized drug is lipid soluble. Anything which is lipid soluble, you all know the cell membrane will only let pass selective permeability. Remember from your 11th class? So, beta, any drug would pass the cell membrane if it is lipid soluble. So, only the unionized, repeat after me, unionized drug which is lipid soluble will only cross the barrier, the membrane, and it will be absorbed. Clear, everyone? Ionized part is water soluble. It is not going to be absorbed. So it is not going to cross. Right? So this is the basic concept. Now, how you have to use this concept? See, beta. Now let us come to the question. A highly ionized drug. So, beta, your key point is ionized. See, in every question, I always tell all my students to use the bell words or the buzzwords. The bell words mean, see, beta, you have all seen in the movies whenever you meet your, somebody who is your love interest or somebody who's your crush or somebody, you are destined to be together, how the music plays in the background, right? Shah Rukh Khan movies, right? Always with a piano, ready with a piano or with a guitar. He's always ready with all of that. Similarly, beta, this any kind of question in any subject, any question, any subject will always have that particular sound, which is bell sound, burst sound. You need, or you can say a cue point. If you catch hold of that cue point, whether it is a 10-line question or a 1-line question, you can solve that question. Okay, so what is my cue point, bell point here? Ionized. As soon as I hear ionized, my mind, starts playing the piano and guitar. Now, what is it? See, beta, kidney hai. Kidney may we all know excretion happens. Correct? So there is lot of water excretion happening. Correct? Yes? Just keep on saying, everybody, just like offline class. When I say correct, you say, yes, ma'am. I'm going to hear it. I have all my cameras fitted into your rooms. Right? So I am going to hear when you say, yes, ma'am. No need to write. But yes, ma'am, you say to yourself. Okay? So there is a lot of water loss from the kidney, right? Urine. Correct. So, beta, by the concept that I told you, any drug which is not going to cross over is going to remain here. This is a membrane. Out of ionized and unionized, which is going to cross? Unionized is going to cross and again go back to the blood. Whereas in the nephron, this is a nephron. In the nephron, the ionized drug is going to remain in the water. Correct? Because ionized does not cross, is water soluble, and it does not get absorbed. So when this person does urination, the ionized drug is going to come with the urine. If this concept is clear, give me a thumbs up, everyone. I want a thumbs up. So by the time I take my coffee, the black espresso coffee without sugar, I want thumbs up. Same CKR, the concept and knowledge is going to be applied in the next question. Very good, everybody. Very good, everybody. Very good. So that means, coming back to the question, a highly ionized drug is excreted mainly by the kidney. Wow! I am a hero. First option is correct, but I am not going to stop over here because there are many options when you have all of the above, both A and C, both A and D, something like that. Right? So, what am I going to do? I'm going to read. I know A is correct. Okay, let us see. Can cross placental barrier easily? No. Is well absorbed from the intestine? No. Ionized drug is never absorbed. What is absorbed? What is absorbed, everyone? Unionized. It accumulates in the cellular lipids? No. When it cannot be absorbed into the body, how can it accumulate? So that is why I know A is correct. And that is how you do a question. How you do a question, everybody? And that is what we will teach in PAATHSHALA. How you do a question? Buzzword, buzzword, buzzword. Cue point, bell point. And what do you, when you find out the answer, you apply the concept, you still read the question fully. Okay. Next question, everybody, is again the same concept. Let us see. About acidic drug. True is best absorbed in acidic medium, best absorbed in alkaline medium, not absorbed in acidic medium, binds to alpha glycoprotein. Okay, no need to answer. See, I will teach you, then I will ask you the question, and that question you should answer. Okay, now again, same concept, but a different kind of a outlook for that question. See, there is this acidic drug, right? I keep it in two mediums, everyone. One is the acidic medium, the other one is the basic medium. Correct? Acidic, in acidic environment, unionized or ionized. Tell me, if I keep an acidic drug in acidic medium only, same medium, same pH, they are not going to be broken down. Now, you all know from chemistry, if a molecule has to break down into ions, we need to give a different kind of environment. And that is even true for the humans. I will tell you later. So, acidic drug will break down in the basic environment. In the acidic environment, it is going to be more of very good, unionized. So, will it be okay? Answer to yourself, everyone. Is it going to be water or lipid soluble? Yes, an acidic drug in the basic medium. Wow, I have given something to break it. Right. So, what will happen? I will have more ionized. More ionized. So, when I have acidic drug in acidic medium, it is unionized, it is lipid soluble, it is going to cross. Correct? It is going to be absorbed. In the basic medium, I have more ionized, it is going to be water soluble, not going to cross, not going to be absorbed. So, let us see the options. It is best absorbed in acidic medium, true. True. But let me read it. Best absorbed in alkaline medium? No. Not absorbed in acidic medium? No. Binds to alpha glycoprotein? Okay, this point needs a little clarification. There are two types of drugs, acidic and basic drugs. And this is also a PYQ, everyone. Every line that I'm saying is a PYQ. So, in two, I think this is the third question. In three questions, I have taught you 15 PYQs. Right? All those 15 PYQs can come and you can answer now with confidence. Okay? Now, the another PYQ is acidic drugs, they bind to the protein albumin, whereas the basic drugs, they bind to alpha glycoprotein. Very important question, everyone. Right? Please make a note of it. Please revise it. Acidic and basic drugs. Right? Okay, please tell me what is, if I ask you a question, arrange oral IM, SC, and IV in increasing order of bioavailability? Can you answer? Answer. Let me see whether I have taught you well or not. Let me also, this is now my test, not yours. Right? So when I ask you a question, it is my test that whether I've taught you well or not. And you better answer it. Right? Batao jaldi. Please tell me. Increasing order. Very good, Dr. Navya. See, everyone, see Dr. Navya's response. This is the right one. IVSC oral is decreasing order. I asked you increasing order. So, the buzzword. The order was the buzzword, everybody. Now, everyone, you have to forget Shah Rukh Khan. Okay? For 8-9 months, you cannot feel the Shah Rukh Khan kind of music which runs in the background when you meet somebody, right? You have to remember my kind of music. And that is when you see a question, ring, 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 and buzz, 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 buzz. Right? So only one, Dr. Anamika, correct. But I ask you the order. Ascending order, descending order. So you know the concept, everyone. You have the knowledge, everyone. But you miss the buzzword. And then the question will go wrong. Understood? So I asked the order. See the question what I wrote. Okay. Next thing, bete. The acidic and basic drugs bind to albumin. They bind to alpha glycoprotein. Acidic drugs are aspirin, barbiturates, methotrexate. So directly example, they will ask aspirin binds to what? The basic drugs again are very important. Atropine, morphine, and amphetamine. Right? How they will ask this question, everyone? How will they ask this question? Morphine. Direct question. Morphine is acidic or basic? Direct. Indirect question. Morphine binds to albumin or alpha glycoprotein. Or a question like this, where there are 4 options. You need to know, either you need to know, hit the jackpot and know the first answer, correct answer, or you need to eliminate. So for elimination, you need to know the 4 other options too. Correct? Okay. Okay, everybody. Next question. Wow. Answer. Answer, everybody. Answer. This question is not for me, but for you. Yes, tell me. Yes, everyone. See, answer karo. See, what I believe, there's one person, Khan sir, right? He's very famous. I hope you know him. So, Khan sir, he said one thing, you know, which even I believe it resonates with me. He said, you know, I think on Kapil Sharma show or somewhere, that no student is a bad student. So, for me, all of you are equal. Whether you are a first ranker, whether you are a distinction holder, whether you are having a supplementary, that's okay. Whether you consider yourself as an average student or a brilliant student, you are at the same level to me. Each one of you, right? So when I teach you, right? If you study, of course, you can forget because you do not know how to study. See, bioavailability could have been taught straightforward. Bioavailability is this. But when I teach you with the PYQ in my, theory and everything. I teach you how the question is framed. I challenge you to forget it. That's what Khan sir said. Okay, I will teach you and then you forget it. That's my challenge to you, all of you. So I will teach you medicine, physio, pharmacology, the medical part of your NEET PG, and then I challenge you to forget it. Right? You cannot forget it. Very good. So, what is the answer? Very good, everyone. It is more in the ionized A. Good. Okay, now, very simple question. Very simple question. Pharmacodynamics includes pharmacodynamics, and there are two parts, everyone. See, I did not start my lecture with the general definition. What is pharmacokinetics? What is pharmacodynamics? No, that is not the style we do in PAATHSHALA. In PAATHSHALA, see, when you come to the lecture, that is Excel, we will teach you all that, pharmacokinetics. In PAATHSHALA, we will straight away start with what is coming in your exam. So bioavailability is coming in your exam for sure. Okay, so pharmacokinetics and pharmacodynamics. How do I remember it? Even I can get confused. How do I remember it? Say with me, everybody, just like the kindergarten. Pharmacokinetics and dynamics. Da da da. So da is drug on body. Da da da. Say, now I bet you forget it. This question comes in your exam. I bet you forget it. Pharmacokinetics is body on drug. Right. So in pharmacokinetics, I have ADME. Say with me. Repeat after me, everybody. ADME is in pharmacokinetics. What do I mean by the body on drug? I take a drug. What all does my body do on the drug? That is pharmacodynamics. Right? So, that is pharmacokinetics. And it has four things: ADME, absorption, distribution, metabolism, and elimination. Right? Correct, everyone? And drug on the body means I take a drug, what action is it going to have on me? What all it is going to do, like competitive inhibition hai, antagonism hai, is it going to be a potential activator of a receptor, is it going to be potent enough, is it going to be efficacious? That all is pharmacodynamics, right? So I have elimination, excretion, absorption, but not mechanism of action, which is a part of pharmacodynamics. How does it act? On what receptors does it act? Correct, everyone? So repeat after me. Pharmacodynamics, drug on body, and pharmacokinetics is body on drug, and it has four options: ADME. Sixth question, I think now you can answer. Please answer. Please answer, everybody. Yes, please answer, everyone. Please answer question number 6. So this is going to be a quick revision of journal pharmacology for all those who have already done it. And second, for anybody who is new to journal pharmacology, then at least you know the terms little bit, right? Little bit terms you should know. And then rest of the work I will do. Okay, everyone. A CKR question now for all of you. CKR question. Please tell me basic drugs combined to as what? Combined to what protein? Basic drugs. Yes, everybody. Jaldi answer karo. See, no class. See, I told you, no, revision is a basic part of your preparation. You can go on studying, 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 but if you don't revise, it's all waste. Very good. Clapping for all of you. Question number 7. Okay. Now, ma'am, you taught us what is given sublingually. We don't know, not given. So, what is the buzzword, everybody, in this question? Question number 7. Drug not given sublingually. Not is important. If you miss the not, if you miss the not, what is going to happen, everyone? What is going to happen, everyone, if you miss the not? You are going to mark immediately the dinitrate, glycerol trinitrate, isosulfide dinitrate. Right? So, not given me, you have to have a little bit more knowledge. So, question number 7, what does it tell us? It tells us we may do CKR. We may develop a concept about nitroglycerine. We had knowledge about nitroglycerine and we did revision of nitroglycerine. But there was a googly. We did not know about these two drugs. And that's okay, everybody. That's okay. Once in a while, a googly question will come to you. You cannot panic on that. Or you cannot say, Arey, this was not taught to us, or oh my god, I did not study this, I am so bad, this was in no book. No, you just accept it. Right? You accept it. Okay, I have to make, I know one option. I have to now apply a brain. So now let us apply the brain as a amateur. I know about glyceryl trinitrate, but that is not in the option. So what do I do? Should I leave this question? No, I'm going to apply my mind. Why? Because I have a great one. All of you have a great one. Is there anybody who has a bad mind? Raise your hand. Raise your hand. See, raise your hand if you think you have a bad mind. If you think you have a mind which is less than others, raise your hand. Anybody? Anybody? See, everybody, yesterday in my class, when I was having my Excel class, I told anybody can dance. And so anybody can get a rank. It's the rank is not only for government rankers, the rank is not only for the private college students, the rank is not only for the highly intelligent, decorated students like those who worked very hard. The rank is not only for, you think somebody who's a prodigy, anybody can get a rank. That is my motto. Right? So, what am I going to do? Let us see this question. Not. Okay, sir. Let me see. Isosulfide dinitrate. Okay, I have a decent clue. It can be given. Buprenorphine. I don't know. I have no idea. Question mark. Ergotamine tartrate. I don't know. Question mark. So, by the time I reach C option, my heart rate is very high. I see the D option. Albendazole. Albendazole. I think all of you have been in hostels. Or when you were a kid, you all have had eaten, dirt. So you would all have had the stomach worms. And for that, the doctor and your mama would have given you albendazole. So albendazole was never sublingual. Albendazole is oral. So, voila, I do my question. Even if I do not know A, B, C option, I mark D. Because what do I learn from this PAATHSHALA? I learn how to solve the question. Albendazole, I will do these kind of questions by elimination. Right? I'm not going to be scared of the question. I'm going to solve it. Next question number 8. Answer. I'm not going to tell you. I don't know question number 8, everybody. I don't know. I knew it before I came to this class. Now I've given this knowledge to you. So now I don't know. Answer 8. Answer 8, everybody. Very good. How come you know this? Okay. Next, the person who will do question number 9 will get a chocolate. It is with CKR only. Concept, knowledge, and revision. By using these 3 pillars, you can solve any question. Question number 9, everybody. See, the first half of any PAATHSHALA class is going to be more of theory. Why? Because I need to teach you what the topic is about. The second half is going to be all about questions, and the question is going to be all easy peasy ones. Very good. Can you please teach me why? Can anybody tell me why? I do not know the answer. Why, ma'am? Why, sir? So can you please tell me why so that I don't forget it? Why? Because of something which is happening in your liver. Okay. Before I come to question number 10, everybody, right? Read the question. Before I come to question number 10, I need to teach you certain things. Okay. So this is now CKR ka R part. This is the R part. I developed certain concepts with you. Now revision will be done. You would have to tell me. Okay. So now everybody, I give an acidic drug in an acidic medium. Please tell me whether it is more unionized or ionized. Whether it will, see how you have to answer. Please answer like this, like unionized, soluble, what soluble, like lipid soluble or water soluble, and it will cross. Give me answer like this, right? Not 111. Give me answer like this. So for the first option, acidic drug in acidic medium, how is going to be the form? Not just one, everybody. Dr. Pranchal, Swasti, Sonika, Manoj, Namika Beta. I want answer like this: form, solubility, and cross. Like for the first one, it is going to be unionized, lipid soluble, it is going to cross. When I give an acidic drug in a basic medium, it is going to be ionized, water soluble, not going to be cross, it is going to be excreted. For the third one, you give me. Yes, very good. I'm so proud of you. Very good. Very good. Basic and acidic. Very good. Ionized, then it is lipid soluble. Water soluble, not cross. Basic and basic, unionized, lipid soluble, going to cross. Excellent. Now, another concept, everyone. What is pKa? pKa is the pH at which the drug is 50% ionized and 50% unionized. That is the pK of the drug. Correct? Now, this is one thing which you would have to learn. Acidic drug. Acidic drug will absorb more from the stomach or intestine. No ratta required, no mug up required. Stomach has HCl, everybody, and intestine has bicarbonate, right? In the pancreatic fluid, it has more alkaline nature. So acidic drugs will be absorbed from stomach or intestine. Who will answer? That means from the acidic medium will they be absorbed or from a basic medium, stomach or intestine? Anybody who answers will get a chocolate ice cream. Very good. Stomach. And basic drug, intestine. Now, everyone, is there anybody who doesn't understand this concept? You can ask me without feeling any guilty, without any shame, without any thought that I would be judgmental. I am not going to be judgmental ever. Ever, 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 ever. You know why? Because no question is bad or good. You can ask me any question. No question is dumb in my class, and no question is to be left unanswered. For no question, you would be made to feel small. And don't worry about the peers also. Nobody is going to think anything. If you have not understood, is there anybody in the class right now who has not understood this concept, why this answer came? Raise your hand. Right? I am not going to judge you. My aim is to get you the seat. Right? And I will definitely make you get it. Okay. Anybody without any shame, you can ask me any question, any moment, any time. On phone also you can ask. In the class also you can ask. Fine? Okay. So understood. Correct? But, question. See, this is a question, but they will ask you all drugs absorb mainly from. All the drugs absorb mainly from the intestine, whether they are acidic or basic. The reason is acidic drug should be absorbed from the stomach. That is one question. But intestine, can you imagine? Stomach is small, intestine is big. Right? Surface area. So surface area is a major determinant than lipid solubility. Second, the drugs are going to be more in the intestine for the more time. They are going to be for more time in the intestine. And that is why it is important that you differentiate between these two questions. Suppose I give you a question. Acidic drugs are mainly absorbed from. What is the examiner wanting to ask you? Difference between acidic and basic. Second type of question. Yes, Dr. Navya, surface area. Very good. All the drugs, whether acidic or basic, they are absorbed from intestine. Right? So you have to know when to answer what. So from PAATHSHALA, from this particular lecture, what all you have learned till now? Number one, you have to look for the buzzword. Number two, you have to read the options fully, even if you do not, you know the answer. You know the answer in the first go, you still have to read. Third, if you do not know the answer directly, you cannot give up. You follow the art of elimination. And fourth thing, you have to know the difference between how to answer, what to answer, when to answer, language of the question. And fifth thing, you cannot miss not all of the following, all of the above kind of things. Give me a thumbs up if these 5 things are pretty clear in your mind. Yes, give me a thumbs up. After the 10th question, we will take a small break of 10 minutes. Because 10th question is going to be big. Yes? Okay. See this part, pKa part, Henderson-Hasselbalch equation. This is important for INI. So please remind me after the end of the class to teach you this as well. Okay. This portion, the unionized and the ionized, depending upon the various pH, would come more in the INI than in the NEET. Right? Very good. So Henderson-Hasselbalch equation. One more thing I need to revise with all of you, which has been coming in your exam, is routes of drug administration. Right? You all know the roots are enteral, means through mouth, oral, parenteral, sublingual, rectal root. Right? Or parenteral. Parenteral means no use of mouth or the rectal, but inhalational injections, all the injections, transdermal. Intravenous injection, IM injection, subcutaneous, intraarterial, articular, intraosseous, intrathecal, intradermal. Local routes means you apply the ointment, intranasal, skin, you put eye drops, the lozenges, right? Vicks ki goli lo, hitch kitch dur karo. So what is that? Lozenges. You put certain things in the vagina, mouth, in the ear for the local action. Inhalational route is one route, bete, which can be parenteral also. Like through it, I can give drugs to the blood also, and it is local also. Like I can give drugs through inhalation which act on the lung only. So inhalational route, do not get confused. It is both local and parenteral. Enteral means mouth. Enter. Something has to enter. Mouth or rectal. And parenteral means in the injection route. Correct? Next, this has been coming a lot, right? They can give you a diagram like this and they will ask you what is A, B, and C, right? They can ask you this. So beta, please remember intramuscular is given at 90 degree. Intramuscular C is given at 90 degree like this. And you all must know as doctors, not only as dental surgeons, you all must know all these injections. Intramuscular is at 90 degree. Intramuscular we give. Subcutaneous injection is at 45 degree. Intravenous is at 25 degree. And intradermal is at 10 to 15 degree. Correct? So these degrees come, or they can give you these hand movements and they may ask you A, B, C, and D. Right? Which injection is which? Okay. Next type of question which has come in your NEET PG exam. If you all have done your PYQs even once, it has come in your exams and you must know this. What they gave you this kind of a diagram, everybody remember? Is there anybody who has seen this question in the PYQ? Anybody? They gave this kind of a diagram and they marked it A, B, C, D. And then they asked, where would I give the intramuscular injection? Right? So please remember, upper outer quadrant is very safe. All other sides are wrong. Inner, lower, medial quadrant, they're wrong because sciatic nerve passes through it and damage can be done. Okay, so sciatic nerve, to save the sciatic nerve, I can only give the injection in the B area. Yes, Jugjo beta. Yes, Jugjot beta, true. Hana, you have seen this question. So it's very important. And here you have to do it right now, not only when the question will come. So my lectures will include all your PYQs from the last 20-15 years. Right? I work hard. I tell all my students, you do not have to work hard. You just have to work as I tell you. I will work hard for you. I will study Harrison for you. I will study Davidson for you. I will study every book for you. You just have to follow the CKR, the revision. 3 times me, 4 times you. 3 times me, 4 times you. That is my funda, everybody. 3 times me, I will do the 3 times revision with you. 4 times revision you have to do yourself. And then you are like, what is that unstoppable machine? Arnold Schwarzenegger's movies there, no? He's like unstoppable. I'm forgetting the name of the movie. What is that movie? Terminator. Terminator, yes. I hope all of you have seen that movie because I saw it and the Terminator is unstoppable. Right? So you would fall, become a Terminator. I hope that is the movie. I know Arnold. Okay, the next question, beta, since this has already come in the exam, it can come again. But now they may ask you where else can you give IM injection. So deltoid muscle you can give. Deltoid muscle, and in this triangle, see, this is the acromion process. You feel the acromion process, and then below it in the triangle, you do the injection. Okay. So what are the various IM sites? Deltoid, yes. Okay. This is the vastus lateralis. Vastus lateralis, again a PYQ. Jugjot, have you seen this PYQ? Vastus lateralis, beta, if you have ever gone to a pediatrician, you are too young to go for your own kids, right? But if you have gone with your brother, sisters, or with your, relatives and taken small kids for vaccination, then you would have definitely seen where the injection is given to the kids, to the infants. It's given in the lateral thigh. Lateral thigh. So, the lateral thigh or vastus lateralis, right? That is the site of injection for the children, for the vaccination, for the infants. Again, a question. This question, the site which we marked as B is known as ventrogluteal site. Ventrogluteal, V. See, this is making a V. This site is making a V. So I call it ventrogluteal. Right? Confusion in the paper will happen because the paper will have option dorsogluteal, ventrogluteal. Oh my God. I get confused now. So remember V. V ventrogluteal. Dorsogluteal is never ever taken, beta, never ever taken sciatic nerve injury, which is going to be very painful. Rectus femoris earlier was used, not now at all. So three sites I'm using: deltoid muscle, vastus lateralis, ventrogluteal. Best site is ovio-ventrogluteal. Adults के लिए we use deltoid, right, for the obvious reasons. And vastus lateralis is for kids. So 4 questions done. Correct? Okay. Now types of injections, degrees you should know. You will get to know by the angulation what all is there. By the subcutaneous route, bete, I injected into the fatty tissue. So subcutaneous, if you would have seen somebody who is diabetic in your family, you would have seen insulin injection, insulin pen, or heparin injections. Insulin you would have definitely seen. Right? Somebody. So that is injected into the subcutaneous. Right, everyone? So IMA, hepatitis B vaccine, all of you must have got it. Tetanus vaccine, all of you must have got it. So you know vaccines are given. IV route is for immediate action. It's for immediate treatment. So by IV route, I want any action. So suppose question comes, Ramu, he's my favorite patient, Ramu. So if you are going to be with me in my classes, you need to know Ramu. Javer beta. I'm sorry if I pronounce anybody's name incorrectly. Javer, I am. Beta, no, only this class and one more class. Any class which we are having for the YouTube free, that is going to be there. Otherwise, PAATHSHALA is separate. Okay. Okay. So why we are doing it on YouTube? We are doing it free on the YouTube for the first few classes so that at least you get to know what we are teaching. Right? How we teach and what we teach and how we can make you get a rank. Right? I'm not saying I can make you get a rank. No, I am not a magician. I am not somebody who can grant your wish. But I can surely make you, follow a path which guarantees success if you follow it. That if is very big. Whatever I do, I know my pharmacology, I know my medicine, I know my Harrison, I know my Davidson, I know my everything, I know my dental subjects. But that is not going to work the magic. The magic will happen when it is 3 times me and 4 times you. Yes? Okay. Now the another one is better intraosseous. In the intraosseous, we give injection into the bone marrow. Again, it is used for the certain drugs and for emergency. I hope that is very much clear. Right? Okay. So we will take a break after question number 10. I hope you all are not tired. I really hope you are all not tired. Yes. Just give me 1 second. Hello. हाँ जी मैम. नहीं नहीं मैम पूर्ति में है. आ जाओ मैम आ जाओ. मैं क्लास. Yes, so are you all tired? Anybody who is tired can raise the hands. Question number 10. After question number 10, I will give you a small break. After that, you all can do the questions. You know, the questions are going to be very easy. I'm going to tell you the tricks and the tips and the questions you can do. We have to do 50 questions. Can you imagine? 50 questions and we are going to be exam ready. Right? That is my challenge. 50 questions will make you exam ready. Okay. For this topic, everyone, not like the exam ready, because for that you have 19 subjects and each subject has at least thousands of topics. Right? Okay. Which teratogen causes deafness? So I don't want the answer. Don't give me the answer. First of all, what is teratogen? Teratogen is something which I give to a pregnant lady. I give to a pregnant lady and the baby suffers the consequences. Now, beta, there are certain topics in the paper from which question definitely comes. Definitely. Like no paper is made without these questions. The first topic is teratogenic drugs or their effects. The second topic is antidotes, which you must have seen even in 2026 paper. No paper is made without these. Right? So, coming to the first topic, teratogenic drugs. Very important, everybody, and the diagrams and the images can come. So, warfarin. Please, everybody, pinch your nose like this I'm doing. Pinch the nasal bone. You all know na, which bone on the face is the most prone to fracture. Again, a PYQ from oral surgery. Nasal bone. Nose is most prone to fracture. Correct? In any kind of contact sport, nose is first to be broken. And that's a good thing. Because if we break our mandible maxilla, you all know the procedures. If we break our zygomatic arch, God bless us all. If we break our frontal bone, we are like totally done up. And then another PYQ, the forceps, which is used when the nasal bone fractures. You will tell me the answer. What is the name of the forceps which is used to bring the broken nasal bone into position after the nasal fracture occurs? Oral surgery, 2 questions, PYQs. Okay, everyone. So let us start. Warfarin is a drug which is an anticoagulant. It causes pinch your nose very hard on the bone area. Right? That is warfarin. What? What will be the question when I tell you to pinch your nose hard? It will be what? So warfarin. I know I'm teaching you like a KG student, but that's okay. That's a fun way to study. Right? It's a fun way. See, life is why so serious. Joker, Batman. Right? I love Batman and I love Joker. Joker's like, if you have you seen Batman? And have you seen Joker in the Batman? Yes or no, everyone? Yes, so Joker's famous line is, why so serious? Don't be serious in life, my dear students. Everything is going to fall into place. Everything is going to become good for you. Right now, maybe the struggle is there. Maybe, okay, then see it on the Insta, okay? Insta or YouTube. See it on that. And maybe at this time you feel my life is all bad. I have not got MDS. If you are in post intern, that my life is bad. I am not settled. My friends, especially the engineers, they are earning so damn well. I don't have a single penny. I can't buy my own food. I'm dependent upon my parents. How do I take money from my parents? Well, every Volsham, very good, Neha. And Volsham for sabka third PYQ is image. So see how quickly we revised even oral surgery. 3 questions. So image of Volsham forcep, you please see.
मैंने अपने मैम को बताया था कि मैं अंतर की
Right, everybody? So now warfarin, say pinch your nose, what? So nasal hypoplasia or a saddle nose, everybody. Saddle nose is the condition. Right? Next, calcific stippling of epiphysis, eye defects, and hearing loss. Now see everyone, the saddle nose. The saddle nose. This is the classic image you are going to get. Classic image. You get it? They will ask you which drug would have been given to the mother. But having said that, you would have to even learn all the 4. Okay. Next drug is valproate. Valproate is anti-epileptic drug. So it leads to neural tube defects. 2 PYQs, everyone, which are going to be shared right now. First of all is this image. This image, everyone. I'll show you the bigger version also. This image will come. Right? And they will ask you, this has happened to the baby. Now, please tell which drug could have been given to the mother. Right? So, this is valproate. They will show you the image and they will ask you. The second type of question is a drug was given. A drug was given. This happened, this condition, B condition happened to the baby. What drug could have been given prevent this condition? So A, B, C question. So A, valproate. B, spina bifida or the neural tube defects. And C, what I could have given to this mother. If I was giving valproate, if I was sure that this mother is going to take valproate, what I could have given to this mother to at least prevent this? And that is folinic acid. Folic acid, folinic acid, folic acid. Excellent, Dr. Sharandeep Kaur, excellent. And that too, a lot of dosage has to be given. See, 5 mg is seen. Now, folic acid, 2 PYQs from folic acid, 2 PYQs which are from medicine, which I'm going to do it here in journal pharmacology. Number 1, they will ask you which vitamin is given just before the pregnancy or just when the mother is thinking of conceiving. Suppose mother, a girl or a lady wants to conceive. So which vitamin would a gynecologist give to that mother is folic acid. 5 mg daily, even before conceiving. If she has not taken it, then as soon as she gets to know, she has to start taking it daily for the first trimester. Right? Second PYQ is this. Suppose she has been given a drug which causes the neural tube defects. Folic acid has to be given, but this time it has to be a lot, 4000 mg. Lot of dosage. And this is the image, classic image, which you will get. See? Spina bifida. Why does it happen? What is to be done? Okay. In Goa, not Goa, in Go Goa Gone movie, right? I am a movie freak. I love watching movies because that is the one thing which makes me happy. When you are very tired of reading your books, you visit the movies. So I watch a lot of movies. So if you have seen the Go Goa Gone movie of Saif Ali Khan of zombies, right? No, Neha beta, they are not the same. Just one salt difference is there. Just the like trade name, market name. Okay. So folic acid is the vitamin. Folinic acid is the drug. Okay. So in Go Goa Gone, there is a line, zombies, that what do we know? What have we learned? So your study is going to roam around this line. What do I know already? And what have I learned from the classes? I'm going to combine all of that and make use of it. Okay. Next question, everyone, is thalidomide drug. Now, beta, in the early 80s, in the European countries, there was a lot of nausea associated with pregnancy. You all know that, right? So there is a lot of nausea associated with pregnancy. And to avoid that nausea, in European countries, thalidomide drug was given. It was given and it was very effective. All the pregnant ladies were very happy. But when the babies were born, they were born without proper limbs. Can you see? They don't have the forearm, hind arm. They don't have that. Right? They may not have both the legs and both the arms. Right? This was phocomelia, absence of limbs, proper limbs. Only the hand is there, limb is not there. A very important PYQ, thalidomide drug. Luckily in India at that time, India was developing nation. We had no access to phocomelia drugs. The thalidomide drug, there was no access, right? So sometimes, what we were struggling in the 80s, like we were struggling with the finances, India, but it safeguarded us from the problems that were happening outside, like thalidomide drug. Whole of Europe has lot of babies of especially my age. Like I'm born in 80s, so I know a lot of babies my age in Europe right now are having phocomelia, but none in India. Right? So sometimes, bete, what we consider as our bad luck proves to be a good luck. Right? Chal. Next, tetracycline. Very famous, everyone. Tetracycline stains. So tetracycline, if I give to the mother, I should not give it to the mother and to the children below 8 years of age. Why? Because there will be permanent staining of the teeth. Right? The teeth will become permanent. Now, herein, I would like all of you to take one homework. Yes, I do give homework. So homework is a must. Right? Because see, I know my Pharmac, OP, OMR, anatomy, physio, endo, ortho, everything, right? So whenever I am teaching anything, any question can pop up from anywhere. But I cannot possibly teach it in that 1 hour or 2 hour. Right? But I have this in me that my students should not miss it. So homework for you all. You are going to read from your oral pathology staining topic. And especially tetracycline staining, which tooth is affected. Suppose I give tetracycline to this particular age group, which discoloration happens, after what age can I give it, right? Systemic. So this is your homework from oral pathology. You are going to read the different kinds of staining. Okay, because if I take it right now, it is going to be at least 20-25 minutes. Right? But I do not want you to miss it. I want you to read it after the lecture. Okay. Very important, very recent MCQ in your paper. Very recent. Have you seen it? I'll tell you. A mother was given a drug. Correct? A mother was given a drug. The baby and the mother both had cartilage and tendon rupture. Or a lady is given a drug. She suffers from Achilles tendon. Achilles tendon means broken cartilage. Fluoroquinolones. So fluoroquinolones are also never given to a pregnant lady. Correct? So ciprofloxacin causes maximum tendon rupture. And this happens in the transplant patients, diabetes patient, kidney patient, elderly patient, right, everybody? And majorly, Achilles tendon is involved. Usually, you get a direct question. There will be some problem with the cartilage and the tendon. This buzzword. So, this is my buzzword. This is my keyword. Beautiful butterfly. And this is my keyword. Correct? Or if they want to make a newer kind of a question, they'll give you this image. Right? Or this image, like this question is there. Which medication is most likely to cause tendon rupture? So I do not know which tendon it is. I do not know the upper hand anatomy. Is it correct? Right? We don't know. We don't need to know. Correct? We don't need to know the anatomy. But if my buzzword was tendon rupture, and I know it is going to be a fluoroquinolone, I will look, this is a penicillin, this is my answer, but still I will read the options. Doxycycline is tetracycline, clindamycin is different drug. So this is my fluoroquinolone, this is my answer. Okay. The next drug is phenytoin. Again, very important. See, teratogenic. Any drug can be asked in teratogenicity. Any drug. So you have to be well versed with every drug. Now, phenytoin causes fetal Hayden-Toine syndrome, wherein the first thing is small head, microcephaly, cleft lip and cleft palate, and small fingers. So everyone repeat with me quickly. What was in warfarin? Pinch your nose, saddle nose. What was in phenytoin, everybody? Phenytoin, small head, small fingers, cleft lip and palate. Repeat karo. Small hand, small fingers, cleft lip and palate. Correct? Phenytoin as such is a very important drug. And I think we will do it in PAATHSHALA whenever we are doing that drug, anti-epileptic drugs. Right. One more very important point from our perspective from oral pathology and perio is it causes gingival hyperplasia, gingival enlargement. Again, homework number 2. You are going to read from perio the topic gingival enlargement. From your notes, obviously. From your notes, not from the Carranza. Okay. Now you do not have to read Carranza notebook at all. You do not have to read it or any other book. You just have to refer it. Right. So from your notes, whatever notes you have to read it. Okay. It also leads to hirsutism. But we will do all of these when I do phenytoin. Right now, I'm not teaching phenytoin. I'm just teaching the teratogenic effect. Okay. 2 homeworks given to you. Please do it by the next class. Okay. So lithium. Lithium beta. First question. What is the drug of choice for acute mania? Lithium. Now another question. A patient Ramu had manic attack, acute mania. I had to give a drug to him. I gave it. And I even continued it for life. After some time, his heart showing abnormality. He was having lethargy. He was not able to work. So his echocardiography was done. When echocardiography was done, a floppy valve. Floppy kya hota hai, Move your fingers like a jelly. Floppy. See, beta, in our heart, the walls are very strong. They're very strong. They are like gentlemen. They are floppy, floppy, okay, like jelly man. So our valve has become jelly-like. Right atrium and right ventricle mein there is a floppy valve. And that is known as Epstein anomaly. So when I give lithium for a longer period of time, Epstein anomaly, floppy valve can happen. 2 questions, very important. Okay. Next is alcohol. Again, very important, everyone. The teratogenic drugs are very important. I cannot pinpoint one drug. You have to learn it. Simple. Fetal alcohol, you all know alcohol is prohibited for the pregnant ladies. Absolutely. It is prohibited. So, what is important? The lady, once she gets pregnant, she has to leave the alcohol. Okay, as such, alcohol is not good, but see, for the drugs, as a teacher and as, of course, your elder also, and somebody who follows this, for any kind of drug, everybody, I know you are young, you are going to experience stuff. Just remember, alcohol still is okay, little bit, right, in control, but the drugs, say no first time and say it every time. Do not do it for ecstasy. Do not do it for just the spirits. Don't do it for testing. Don't do it as a dare. Don't do it to become cool. Don't do it to forget someone after you have had a heartbreak. Don't do it in distress or sadness. Just say no first time, every time. No, beta Sneha, PDF nahi hota hai. You will get the question booklets. Okay. Now, alcohol, everyone. See, these all the images are the Google images. I have not got it from any standard textbook because now the examiners are very young. They are all using Google and AI. So I have used it from Google. Okay. So you can all find all these images in the Google. So alcohol, what is going to be the characteristic thing? The baby is going to look like this. He's very cute, but his mother drank alcohol. The small eye opening, low nasal bridge, smooth philtrum. Can you philtrum is the area between the lips. So that is going to be very smooth. And upper lip is going to be very thin. So it is a fetal alcohol syndrome, which also has microcephaly. Which other drug had microcephaly? Small head, small hands, cleft lip and palate. Which drug had it? Can you please answer? Which drugs? Which drugs? Song was small hand, small head, and cleft lip and palate. Which was that drug? Very good. Very good. Next drug is carbimazole. Carbimazole drug. Very recent question. Okay. So a patient of hyperthyroidism, a pregnant lady who had Graves' disease or hyperthyroidism, was given carbimazole. She was given not thalidomide, beta. Thalidomide was Sharandeep. Focomilia. It was Focomilia. Correct, bete? Okay. Correct. Now, beta, this image came in the exam. And this image, I think this one was there. Or the yellow one or red one. Some problem in the scalp, skin. And there was nasal obstruction. So history, long history given. A pregnant lady was having hyperthyroidism, right? Thyroid hormone was more. There was something seen on the scalp of the patient. The mother got scared, got to the clinic. The doctor saw, told her to stop a drug, asked her the history. So much long question will come. But what is the Q point? Q point is aplasia cutis. This is aplasia cutis. And this is guanal atresia. Aplasia cutis and guanal atresia. Correct? So if you see these two words, you know it is carbimazole. And that is why bete carbimazole is never given in first trimester. The drug of choice, this is also an important question for hyperthyroidism in a pregnancy is propylthiouracil, PTU. So see, one diagram, 3 questions. Right, everybody? Okay. Quenal atresia may not be asked just given this name. They will give you the baby has difficulty in breathing because the nasal airway is blocked. Okay. Next is diethyl stilbestrol. So that is number one, it causes stillbirth because it has the name still. Correct? Second, if it is given, then beta, and if it is a female baby, the female baby will have adenocarcinoma of vagina. Correct? Next is isoretinoin. Isoretinoin is given for the skin, for the vitamin A and all that. And this leads to deafness if it's given to a pregnant lady. Deafness, anosmia, microgia. Anosmia means complete absence of the external ear and even the ear canal. So very, very important. All the things are important. Isme there is nothing you can forget. I cannot pinpoint कि भाई no only thalidomide, no only warfarin, no only phenytoin. All the 10 drugs that I have taught you, they are very, very, very important. Correct? Let's have a break, everyone. Let's have a break and let's meet after 10 minutes. Yes, everyone, we are back. Hmm. Yes, yes, everyone, we are back. Okay. Okay. Now let us do some questions regarding this. Okay. So which teratogen causes deafness? Now can you answer? Yes, everyone, can you answer? Well, Pathshala workbook bete we get before the course only, all the workbooks, and we send it before the classes start. So you will get the workbooks. Very good. Alcohol, you all know. Warfarin, you all know. The saddle knows, right? Alcohol, you all know. Chloroquine, nothing. Okay. Next, question number 11, everybody. Next, question number 11, everybody. All of the following are teratogenic except means you have to answer what is except, right? So this word is very important when you are doing the questions. It is metochlorbromide. Next question, everyone. Okay, let us see and try this question. At pharmacological dose, matlab the dose which is given to treat a particular condition, unwanted, unavoidable effects are called side effects. These are side effects, everyone. They are unwanted, but I cannot avoid it. Right? Like some of the drugs, if I give it at a pharmacological dose, they will lead to stomach upset. Some drugs will lead, I give it for a treatment, but it will lead to some unavoidable side effect. Right? So, this is the side effect. Correct, everyone? Next, let us see what is idiosyncratic. Idiosyncratic is rare, unpredictable, and highly individualized. Response to a substance that does not occur in all people. So, what is a side effect? I know it is going to happen. I give it at a dose which is, I give it for treatment, but I cannot avoid it. What is idiosyncratic reaction? It is very rare. I do not know about it. Like I have been given this drug since 20 years. 20 years I gave a drug. But one day a patient comes, I gave the same drug considering it is the safest. And some rare kind of a thing appears, which is not even written in the books, which is not even documented. Maybe that is idiosyncratic. And that is not related to dose. Not related to dose. I give a small dose, big dose, large dose, medium dose, whatever dose. It is not related. Why would it happen? Because of genetics or immune system of a person or something, that particular drug is becoming allergic or becoming problematic for this person. Agreed? What is toxicity now? Toxicity is when I give the drug for large dose, And what effects occur? Like if somebody takes a large amount of alcohol, or if somebody takes a large amount of atropine, a doctor gives a large amount of atropine, what is going to happen? Somebody takes a large amount of adrenaline, what is going to happen? Somebody takes a large amount of drug like valproate, toxicity, right? So that is toxicity. Side effect is at a dose which is pharmacological dose. That means a dose which is used to treat a condition by the doctors. At that dose, what is the unwanted, unavoidable side effects? Right? So difference between side effects, toxicity, and idiosyncratic reaction is clear. Now, what is pharmacogenetics? Usage of genetics in pharmacology, how the drugs are going to react with the other genes, how a different genetic pool people are going to react to a particular drug. Clear, everyone? Okay. Question number 30. A study of how variations in the genome affect the response to medications is known as. Very easy. Genes, genome. So the answer has to have genomics in the name. So that is pharmacogenomics. Pharmacokinetics, you all know. That is the body on the drug. Pharmacotherapeutics is what? Therapeutic means treatment. Right. So pharmacotherapeutic is branch that will apply info about how a drug is able to treat a particular condition. How will it prevent a particular condition? How will it mitigate, cure, or diagnose a condition? So therapeutics is how a drug mitigate, prevent, treat, cure, or diagnose a condition. That is pharmacotherapeutics. What is pharmacovigilance? Very important PYQ. Have you seen this PYQ, everybody? Have you seen this PYQ? Pharmacovigilance pe once there has been a PYQ in NEET, once in INI 2. So what is pharmacovigilance? What is vigilance? You keep an eye. You keep an eye open. So pharmacovigilance, you don't need to learn these definitions. No. You will just mark them according to your journal knowledge, according to your common sense. So no need of rectification of this particular question. So pharmacovigilance is detection, assessment, understanding, and prevention of the ADR, that is the adverse drug reactions with any drug. Vigilance means what does the vigilance do? The vigilance keeps an eye on the bad elements in the society. So what the drug is doing bad, you keep an eye on that. Okay. Next question. Protamine antagonism for heparin is. Now here, before we do the question, we have to do antagonism. What is antagonism? Two drugs acting differently and they are producing opposite action or they're cancelling each other's action. Correct? So let us quickly revise what is antagonism. Okay. So antagonism can be bit of physical. Physical means it's like a ball which absorbs, or sponge, right? Sponge is a very good example. Sponge absorbs all that there is like water. So that is physical. Absorption. The physical is charcoal. Like charcoal I use to absorb many toxins. Now, chemical. Chemical means like there is a lot of acid in the stomach. I give a drug A and it acts like an antacid. All of us take it. It is the fast action. Right? Immediate action ho jata hai antacid se. right? Whenever you have acidity in your tummy, so antacids are given. So what is their reaction? They will balance out the acidity. So chemical means balancing. Similarly, antidotes are balancing the various high doses or toxicity of drugs. Like for heparin, the antidote is protamine sulfate, and it is a kind of chemical. It will balance it out, it will cancel the effect. Next antagonism is physiological. Physiological means there is two drugs, everybody. Please pay attention, this is important. Physiological and pharmacological is important. There are two drugs, A and B. When they act on same receptor, it is known as pharmacological. R. How do I remember? Pharma has R. So R is same receptor. Right? Physiological means when A acts on R1, B acts on R2. That means A acts on different receptor, B acts on different receptor, and they produce opposite effect. Now, this example has come many times. Physiological antagonism is histamine and adrenaline. Histamine acts on H1 receptor, adrenaline acts on B2 receptor. Pharmacological action, they will act adrenaline and atenolol. They will act on the same receptor, but atenolol is a beta 1 blocker. Adrenaline, when acts on the beta 1 blocker, beta 1 receptor, it will lead to increased heart rate. But atenolol on the same receptor, same is the story, acts by decreasing heart rate. So remember this, pharma has R, meaning there is only 1 hour. 1 hour, that is 1 hour receptor, one receptor. When there are two receptors, then please remember, if I really twist it, I can write 2. If I reverse it or do a mirror image kind of a thing, I can do 2. So, 2 receptors, it is physiological. Right? Repeat after me, everybody. Physiological is S means 2, 2 means 2 receptors, opposite effect. Pharmacology has R, so 1 receptor but opposite effect. Is it very clear, everybody? Give me a thumbs up if it's very clear. You have to give me a thumbs up, because that is what is my fuel. Okay. Now, question number 16 would be the last question of the day today. Okay, now question number 15, let us do. First is protamine antagonism. Question number 14. Let us do question number 14 today. Protamine antagonism, protamine sulfate, it is a very important PYQ. What is the antagonism of heparin? What is the antagonist or antidote of heparin? That is protamine sulfate. So what kind of competition is it? It is not competitive. It is not toxic or non-competitive. It is a clear-cut chemical antagonism. Okay, just like acidity and antacid. Next is physiological antagonists, right? So what are physiological antagonists? They are, tell me, what should be the answer here? Adrenaline acts on different receptor, raises blood pressure. Histamine acts on opposite second receptor, R2, and it decreases blood pressure. So adrenaline and, not all beta, adrenaline and histamine. Adrenaline and isoprenaline and propranolol, they act on the same receptors. Right? Histamine, you cannot forget, Dr. Swati. These two examples you just cannot forget. Adrenaline and atenolol, histamine and adrenaline. One is of physiological, the other is of pharmacological. Yes? Okay. Last question for the day. which involves a lot of concepts. So it is the last question of the day. After that, I will do question number 19. Okay. Okay. Yes. So let us do this question. Potency. First of all, please tell me potency is a part of pharmacokinetics or pharmacodynamics? It is a part of pharmacodynamics. Da da da. What does the drug do to the body? Right? So what is potency, everyone? There are two terms over here. One is potency, the other is efficacy. Lot of questions are framed from these and they're very easy concepts. So this would be my last concept for the day today. What is potency? Potency means how much quantity. Please be very careful and please listen very nicely. How much quantity of a drug produces a desired effect. Correct? So there are two drugs for suppose painkillers. I need 10 mg of A and I need 20 mg of B. Right? That means A has more potency. A has more power to bring the effect at a lower dose. So beta, lower dose, higher the potency. Clear? Second, what is efficacy? Again, I have A drug and I have B drug. The A drug finishes the pain 100% and the B drug does it 99%. It is more of an anti-inflammatory drug. Which is more efficacious? Efficacious drug is A. Right? So do you understand the difference between potency and efficacy? Potency is dose dependent. Dose dependent. Efficacy is dose independent. Clear, everyone? If this concept is clear, let me take you further. See, beta, the potency and efficacy, they are calculated or they are seen on a dose response curve. Right? What is dose response curve? I have response and I have dose over here. Response on the y-axis and dose on the x-axis. Correct? Now, when I plot this graph, the normal DRC is hyperbola in shape. And as we all know from our old geometry days, old graph days, hyperbola is not comprehensible. It is not comprehensible. Like I cannot, really convert it into words if I'm not a mathematician. Right? So hyperbola is not clinically used. So DRC is not clinically used. Instead, I do the log DRC, log dose and response curve. Right? Log dose and response curve. Now, what is log, bete? Remember in our mathematics classes, we all used to have that log 0, log 10. Log 10 is 1, log 10, 100. All that, the pages at the back of the NCRT book. Right? That is log. Fine. So log DRC I'm doing. And this is S-shaped curve. Now this S-shaped curve, I can easily decipher, I can easily use my mathematical limited knowledge and I can make use of it. Right? And by this, I use it clinically. So first question, out of DRC and out of log DRC, which is used clinically? Log DRC. Second question, it is an S-shaped curve. It's not hyperbola, it is S-shaped. I use it for three things: potency, efficacy, and slope. What is potency, everyone? Efficacy is the maximum effect of the drug regardless of the dose. Potency is how much dose of the drug produces a particular effect. More the dose, less is the potency. Less the dose, more is the potency. Right? The second kind of question which comes on potency and efficacy is this diagram questions. So for all these diagram kind of questions, I want all of you to remember help. Jaldi se bolo, help. Help. This is the thing that we teach our kids, right? And even you, especially the girls. Especially the girls, I want to teach you one more thing today. That if you are in a bad situation, when you are alone on a road and you are, comprehending or feeling or sensing something unusual, right? Shout help. Don't just bachao, don't do anything. Shout help. Help everybody understands in India and anywhere. And do shout, do not freeze. Okay. Now what happened? I'll tell you. This I am teaching you, but I forgot. I forgot the same thing. Abhi recently, right? About 3 days back, I was in Goa and we were going a forest trail, right? We were doing a forest trail and there came a snake. Like the snake was lying. I think it was dead. Later on, I think it was dead. So there was a snake. Okay, a very small baby snake, right? And when I saw it, I was like, oh my God, snake. This was my voice, very, very, very less shrieky voice. Oh my God, snake. And I froze. I just stood there. Right. And just behind me was Dr. Amir. And what he did, he just, he was so terrified. He just pushed me, towards the snake and he ran. And he actually ran forward. He pushed me towards the snake. Thank God the snake was dead. Right. So this is what I did wrong. I teach my kid that do not freeze in panic situations. But I too froze. So you have to keep on reminding yourself, girls and boys, especially girls, do not freeze in any kind of bad situation. Cry help, run for safety. Right, everyone? And you have to keep on reminding. Because, see, I do it in every class. I teach my daughter also, but I froze. Right. So one time, a monkey came when I was in Taj Mahal. A monkey came, took the ice cream from my child's hand, and that time also I froze. So teaching and knowing is one thing, but you keep on repeating it daily to yourself because you never know when a bad situation will crop up. Okay. So shout help. I know you should have seen him. I was very angry with him. I was very angry with him. I was like, my God, there's a snake, and you literally pushed me towards the snake, and you ran to safety. You did not think, like, if the snake is alive, what will happen to me? Right? So, chalo. Next is help. Higher the graph, higher the efficacy. Let us write down. Higher the graph, higher the efficacy. Correct? Help. And left the graph, more is the potency. Now, what do I mean by it? Higher the graph, like out of A, B, C, D, which has the highest graph, everyone? C. So, C is most efficacious. A and B, they are at same height. So, they have same efficacy. Give me a thumbs up if it's clear till here. Give me a thumbs up, everyone, so that I know you are there with me and you are understanding every concept. This is the last concept of the day. Last concept for PAATHSHALA 1. Right? Least efficacious is the one which has the lowest graph, which is D. Correct, everyone? Give me a thumbs up. I need to see your thumbs up so that I can know that you all are getting what I'm saying. Okay. Most potent out of A, B, C, D, which has left towards your left hand? A graph towards your left hand. Left hand pe the graph is with D, right? So D is most potent because its graph is at left. It requires least dosage, right? Next, least potent is the one which will have the graph at the most right side, which is B, starting point B, because B requires maximum dosage. See, you can correlate with the x-axis. A and B, bete. Now, one question for you. If you have understood the concept, A and B have same efficacy. Out of A and B, question for you. A and B, which has more potency? Which has more potency? Let me see who will answer. See the graph. Out of A and B, yes, yes, yes. Clap for yourself. A is more potent because the graph is at left. Right? I can know the efficacy, but not the effectiveness. See, efficacy is the maximum thing. Effectiveness is also includes time. Like for how much time the pain is going to go away. Correct, everybody? Okay. Now, slope. The third thing I can know from the curve, the dose response curve, is what? It is the slope of the graph. What is the slope, everybody? This is the slope. How the hill is rising? How the is it a gradual rise? It is a steep rise, right? So how it is rising? How the graph is rising? If it is a flat curve, it is considered a safer drug. If it is a very steep curve, that means I give the drug, immediately it starts acting, right? That is steep curve. That is less safe drug. Out of barbiturate and benzodiazepines have a flat curve and therefore they are used for insomnia. And barbiturates are also used for insomnia, but they have a steep curve, they are less safe. What does that mean? Even a slight increase of dose will lead to severe side effects. Correct, everyone? So barbiturates have a steep curve. See how it is rising steeply? And see how this is rising gently. See, you can climb the benzodiazepine curve, right? But you cannot climb the barbiturate curve. So barbiturate curve, if somebody wants to climb, he's going to be unsafe, no? Imagine a person climbing these two curves. This person is going to be safer than this person. Right? So curve of the slope. So three things I do from the log DRC curve, and they are potency, efficacy, and your slope. Correct, everyone? Question PYQ. Why is barbiturate unsafe, or why is benzodiazepine safer than barbiturate? Why which one is given more in the clinical practice? Right? And this help everyone, again shout help, help. It will help you solve many questions of efficacy, potency, and other things. So now can you please arrange A, B, C, D? Listen to the question very carefully. Last question of the day. Can you please arrange A, B, C, D in decreasing order? Decreasing order of efficacy. Decreasing order, everybody. Please don't make a mistake. PA, you only check. Yes, everybody. Anybody else or only cute bunny? C is equal to A is equal to do. Aditi, love you for that. Okay. Very good, Dr. Aditi. Excellent. I hope cute bunny and Neha, you also know the concept. But since probably equal to sign is missing, right? A and B have equal efficacy. Aisha, you also know the concept, right? A and B have equal efficacy. So, everyone, this was the first class of PAATHSHALA. This is how we are going to study, right? So, we are not going to study pharmacology from first to last like a chapter, but we are going to study question wise. So, now you all know bioavailability is very important, potency efficacy is very important. The teratogenicity is very important. So this is Pathshala for all of you, right? Pathshala is going back to when we were kids, how we used to study and how we used to remember and how we used to enjoy studying. See, this 1 year is going to be not very good for you, right? I hate to say it, but these 9 months, 8 months, 10 months of preparation are not going to be very good and very kind to you, right? You are going to break down. You are going to have bad days. You are going to have irritable days. You are going to have crying spells. You are going to be alone. You are going to feel as if you are alone. You are going to think, let me give up. You are going to think that I am useless. Every kind of bad thought is going to come in this period of your preparation, right? So you don't have to be alone in this time. I'm there, we all would be there, and make every subject as a fun assignment. Enjoy every subject. Otherwise, beta, crying will happen. Eventually you will get anxiety attacks, panic attacks. But what you can do at least is enjoy your study time. Just like, the kids used to enjoy the kindergarten. Correct, everyone? So this is what is my requirement from all of you. Study part I will do. Theory part I will do. Question part I will do. That is my headache, not your headache. Two requirements for actually what I want from all of you. Number one is all of you are going to be smiley and happy. You are allowed to be sad because it is important to be sad. Right, you will get sad. I cannot say always be happy, chirpy. You cannot be. You will get sad. I'm telling you up front. You are going to be more sad than happy while you are preparing. But when you come for my class, you are going to be your happy, chirpy best. Right? And second, we are going to enjoy studying. We are going to learn studying in the class. And please remember the rule: 3 times me, 4 times you, and the seat is yours. Okay, everyone? Story time for the next class. Right? I hope all of you enjoyed the first Pathshala class. And I'm Dr. Jasmine. See you again. Bye, Bete. I hope you really, really enjoyed because that is my funda. Enjoy the class, learn the class, and gain confidence that anybody can get a CTR. Anybody. Anybody. Okay? Bye bye. See you later. Any queries? Please ask. Beta, when you are in Pathshala, na, when you are in the Pathshala class, when you will join the course, then we will give you stuff to revise. Yes, Neha? Any other doubt about the class or any other doubt about the course or any other thing? You can ask anything. No doubt. No question is a small question. I'm all ears for you all. Plus, Neha, all these lectures are going to be always present in the recorded section. So you can revisit the lectures anytime you want and watch it at a 2.5x speed or 2x speed. So there are students who, watch the lectures on repeat. Then there are students who take down the notes. There are students who would require some extra notes. So we will do all what we can. Okay, everyone, please leave. Thank you. No more questions. Do I have any more questions? Okay, bye bye. Have a great, great Sunday. See you next time. Bye.